Thanks for joining us today. If this is your first time joining the show, we're the show that talks about everything good going on in our community. And we talk to some amazing nonprofits out there trying to make a difference. And it's a pleasure to talk to this next guest again. We have spoken before, but without further ado, how about you introduce yourself to our listeners?
Sure. Thanks for having me on the phone again. My name is Dr. Kapoor. I'm a breast surgeon, so I'm fellowship trained in breast surgery specifically. I work with Breastlink, which is part of RadNet. We focus on helping women with breast cancer or diseases of the breast. Today is special because October is Breast Cancer Awareness Month. At Breastlink, actually, every day is an awareness day. But for October, it's a national effort to make sure women are doing their self-exams, getting screened properly, and doing whatever they can to help prevent breast cancer.
So with Breast Cancer Awareness Month, kind of just to start with a basic, what are some signs of breast cancer? Because I feel like a lot of us know what that is, but I feel like you can't harp on it enough, really.
It's true, and we keep forgetting, too, or we try to push it to the back of our minds so we don't think about it much. But so hopefully we don't have signs of breast cancer. And if someone's going to develop breast cancer, that's right now in the U.S., 1 out of 8 women, they're finding it with a mammogram. So they're screened without any signs or symptoms. Unfortunately, there are still women who develop signs and symptoms of breast cancer. Often that might be a mass or a lump, and it's going to be a mass that's hard, not rubbery. It's going to be usually stuck and not moving around so easily. And usually cancer-related masses are not painful.
Obviously, if you find any type of lump, you want to get that checked out immediately.
Definitely, but also you want to make sure you're not just finding your normal lumps, that you're actually aware of what your breast should feel like normally. So start by getting to know what your breasts feel like normally every month. Do your own breast exam. See where your lumps and bumps are. If you find something on one side, check the opposite side. If they're both the same, then that's a good sign. And then being regular about it so that you know if there is a change, you'll be the first one to figure that out.
So how do you do self-breast exams?
It's a good question because sometimes women get scared. They say, oh, there's lumps all over the place. I recommend at least doing it in 2 positions, so lying down as well as standing up. There's so many pictures of women doing exams in the shower, but really you can't feel the bottom of your breast so well, especially if you have a bigger, droopy breast. So lying down is very helpful. You want to just cover the whole surface of the breast, usually using 2 fingers going back and forth or in a circular fashion. The idea is to make sure you're covering the entire surface of the breast, usually a lighter touch followed by a deeper touch, back and forth until you feel like you've covered the whole area at least once or twice.
But what about going to a doctor? When should you start, getting mammograms and all that stuff?
There's good controversy, which provides for lots of discussion about when the right age is for a mammogram. Certain guidelines are starting to say wait till you're 50, or depends on your own personal risk. I do believe, and I think all of us at Breastlink really believe, that this is a more personalized approach, which would be looking at your family history, knowing who in your family has had breast cancer. That's one big risk. Knowing what your other risk factors are, and then figuring out what the right age is. So really you want to start talking to a physician about this sometime in your 20s. What's going to be my best approach? If you have strong family history of breast cancer and dense breasts in the family, you might need to start earlier, and you might need to start with MRIs as well as mammograms.
So say you find out that you have breast cancer, and what do you do?
So you find a lump, you want to get that evaluated. Usually that involves a mammogram if you're in your 30s or older, as well as an ultrasound. If you're younger than 30s, usually we start with an ultrasound. So that's step number 1. And then stages of breast cancer go anywhere from stage 0, which is cancer that's stuck in the duct and doesn't have a chance to spread. That's what we like to catch with mammograms. To all the way to, stage 1 is a little bit bigger cancer. Stage 2 involves cancer that has possibly spread to 1 to 3 lymph nodes. Stage 3 is a larger cancer that may have involved more lymph nodes. And stage 4, what we try to avoid, if at all possible, is when cancer has spread beyond the breast and lymph nodes. So it's gone to possibly the bone or the liver.
So what are some different treatment options? Obviously, chemo is one.
Sure, and that's the dreaded one whenever we hear breast cancer. Are you going to need chemotherapy and lose your hair? That's one of the first questions we get. And the great thing about treatment advances and early detection and early diagnosis is if we catch cancer early enough, you can avoid more toxic treatment therapies. Typically, so far as we can tell, surgery is still a mainstay of treatment for early-stage breast cancer. Whether or not one needs radiation therapy, chemotherapy, and endocrine therapy is still a debate, depending on the type of cancer, the age of the patient, how aggressive the cancer is. There's a lot of exciting treatment options out there as well now. So we have shorter courses of radiation. We have targeted treatment with chemotherapeutics that go directly to cancer cells, which makes treatment a lot easier for many patients.
So tell us a little bit about Breastlink. I know you mentioned them at the beginning, but what is Breastlink? What are their services, and what sets them apart?
Sure. So this is my 5th year with Breastlink, and I really love the company. It's a great model of caring for patients with either breast cancer or diseases of the breast. So it's a private system that started in Orange County in the city of Orange and has spread to, we have centers in Temecula, Laguna Hills, Newport, and now finally up in Encino, which was badly needed, where we have our breast radiologists, fellowship trained, dedicated to breast imaging, breast surgeons like myself, and several other of us fellowship trained or dedicated to breast services only, medical oncologists, and then we have plastic surgeons and reconstructive surgeons who are all with us together working to care for women with breast cancer.
So where are Breastlink locations?
So we started in the city of Orange, in Orange County, then went to Temecula Valley. There's a center in Laguna Hills. There's a center in Newport Beach, and our center in Encino now.
Well, I mean, I was it last year that you had just opened your center in Encino?
Yeah, it's brand new. It's been 9 months now, so we've been up and running and actually at capacity already. So we're excited about when our Tarzana Cancer Center is going to be opening. The Integrated Cancer Institute will have not just the services I mentioned, imaging, surgery, medical oncology, plastic surgery, but we'll also have radiation oncology services available. So the whole spectrum of breast care, as well as other cancer care, will be opening in Tarzana by next year.
Well, I mean, the more of these, the better. And it's always so great to talk to you. I'm wondering where can people go to get more information about Breastlink, and who do you serve with the Breastlink location?
Breastlink.com is the easiest way to find all of our centers, depending on where you're located. Obviously, if you're in Encino or in the San Fernando Valley, that would be finding me. We serve a huge population. We cover all PPOs, Medicare. We even are very proud to be serving the Regal Lakeside contract, Prospect, Healthcare Partners. Our imaging centers also even serve Medi-Cal population. So I think it's quite a broad reach and still a very private model. So you're getting to see your doctor, not just the resident or the medical student, as you would find in a lot of academic centers. It's very personalized, very private, and all expert-driven.
Now, Dr. Kapoor, before you go today for Breast Cancer Awareness Month, which is in October, do you have any events or anything coming up on the calendar?
Oh, we are constantly doing events, and the calendar is overwhelming, actually. So we have our Mammo Party Night in Encino in October. We have a Cancer Community Talk again coming up in the middle of October. In a couple weeks, actually, I'm giving a grand rounds at Tarzana Providence Hospital. So we are constantly trying to keep updated. Actually, if you go to our website, you can look at all the calendar events that are coming up for the community.
Dr. Kapoor, it's always a pleasure to jump on the phone with you. Is there anything else you want to tell our listeners before you go today?
I think the one thing we should all be aware of is our health. So October as Breast Cancer Awareness Month, sure, we care about our breast, but what one big driving factor that we can all do to help decrease risk of breast cancer as well as colon cancer, diabetes, heart disease is being healthy. The biggest risk factor for breast cancer after being a woman, aging, and family history is how healthy we are. So watching our weight, being active, limiting our alcohol intake, really critical to all of this. And if we can keep that in mind, we'll keep our breasts more healthy.
Dr. Kapoor, thanks again for jumping on the phone with us today. And just one more time, what was your website?
It's breastlink.com.
Thank you so much. Have a great rest of your day.
My pleasure, Alex. Thanks again.